Welcome to Key Talking Points.
The podcast that makes learning effortless.
No fluff, no jargon, just clear, engaging explanations.
We break down complex topics so you don't have to.
Let's get straight to the point.
Visit keytalkingpoints.com for more. So, Keir Starmer's announcement to abolish NHS England, it's kind of huge, isn't it? It's not just some minor tweak. He's talking about bringing the entire management of the NHS, arguably one of Britain's most cherished institutions, back under, well, democratic control. But what does that actually mean?
Right, it's a monumental shift. NHS England has been this semi-independent body for over a decade now, running the day-to-day operations of the health service. Starmer is saying it's time to dismantle that and integrate its functions back into direct government oversight. The idea is this will make the NHS more accountable, but there's a lot behind this move.
Yeah, and, from the live Q Sarah Jane Mee hosted with Laura Bundock and Mark Thompson, it's clear this announcement has sparked loads of questions, right? Like, people are worried. How's this going to work? What does accountability really mean here? And then there's this, underlying suspicion.
Suspicion, yeah.
That this could just turn into another layer of bureaucracy instead of fixing the issues we already have.
Exactly, and I think public sentiment here is, complicated. On one hand, people do want reform. Services aren't as accessible as they should be, wait times are up, staff are overburdened. But on the other hand, the NHS is a kind of a sacred cow in the UK, isn't it? Any perceived threat to its structure tends to make people uneasy.
Absolutely. And funny enough, it reminds me of the big reforms in the 90s when they introduced primary care trusts. Remember those? At the time, everyone was saying this was going to streamline healthcare and make everything better. But all it did, at least in the short term, was confuse a lot of people and put a lot of GPs under even more pressure. It's like you change one thing and suddenly there's this ripple effect,
Right, and that's exactly what makes these kinds of reforms so tricky. Even with the best intentions, the outcomes can be completely unpredictable. And Starmer seems to be presenting this as a kind of reset for how the NHS is run, which I suppose sounds appealing if the alternative is just sticking with the status quo.
Yeah, but sticking with the status quo isn't exactly an option either. The Q showed just how frustrated people are. One of the questions was about patient backlogs. Thousands of people still waiting for critical surgeries. And you think, okay, maybe a reset isn't such a bad idea. But, wow, the stakes couldn't be higher.
Right, and the question is, will this actually reduce things like those backlogs? Or is it just a political move, more about appearances than actual outcomes?
Exactly. And honestly, a lot of people are asking whether this will just shift the blame around, rather than actually fixing the deeper issues in the system. Which brings us to this idea of democratic control that Starmer is pushing. What exactly does that mean in practice? Because if you look at where we are now, the NHS functions like this massive operation managed by NHS England, with bureaucrats and clinicians navigating these incredibly complex systems. Starmer's vision, though, is about shifting that control back to the government. Think elected officials taking the reins instead of these appointed administrators. But the big question is, will that really address the issues people raised, like accountability or those staggering patient backlogs?
Exactly, and in theory, that sounds quite promising. The idea is that because these officials are directly accountable to voters, it'll mean decisions will reflect what the public actually wants or needs. But at the same time, that raises questions about whether this could just lead to more political meddling, doesn't it?
Totally. Imagine trying to run a corporate-style system, but making it more like a co-op, where the shareholders are basically the public. Sounds kind of democratic in principle, but in practice, who decides where resources go and how do you avoid some areas just losing out?
That's the tricky bit. Take staffing. One of the big concerns raised during that queue was about whether this shift will improve things or just make it harder to attract and retain staff in certain areas. We already know healthcare workers are stretched thin as it is, and now there's this anxiety about even more uncertainty.
Yeah, and honestly, it's hard to blame them, right? Like, if you're a nurse or a GP, you're probably thinking, great, a new management structure. Again, how does this actually help me get through my patient load?
Exactly. And that's where accountability becomes this double-edged sword. On one hand, you could argue the government would have to answer for, say, long wait times or underfunded hospitals. But on the other hand, having the government that involved could mean decisions get influenced by, well, short-term political agendas, rather than long-term healthcare needs.
Right. Like, what happens if the next election brings a whole new set of priorities? Suddenly, the NHS could just be yanked in an entirely different direction. It's got to feel so unsettling for the people working within it.
Absolutely. And it's not just the staff either. Patients are anxious too. Things like delays for surgeries or community health services rely so heavily on resources being distributed fairly. With this shift, there's a lot riding on how well that redistribution is managed.
Exactly, and honestly, I'm not sure anyone really knows what that's going to look like yet. It's like reshaping a puzzle without knowing if all the pieces will still fit together in the end, you know? Right, so with all this uncertainty hanging over how the reform might affect both staff and patients, it's no surprise that it's kicking up a political storm too. I mean, bringing such a massive institution back under direct governmental control is bound to stir up debates, right? How's this going to play out in Parliament? And, even more crucially, how will the public and politicians tackle that ever-tricky balancing act between funding and priorities?
Yeah, funding debates will undoubtedly be front and centre. You've got one side arguing this could lead to more transparency, more efficiency. But on the flip side, critics are already saying this could open the NHS to, well, greater political tug-of-war.
Totally. And it's not like these reforms exist in a bubble, right? Changes in the NHS tend to ripple out to other parts of public service. Schools, transport, social care. If you start shifting resources to meet healthcare demands, something else might end up underfunded.
Exactly. And the idea of bringing decision-making closer to the people sounds progressive in theory, doesn't it? But you have to wonder, are we really equipped to handle decisions at such a local level across the entire UK? Like, would this actually encourage greater civic participation or just spark more local-level conflicts over funding?
That's the big question. And I was looking into comparisons. Take Sweden, for example. Their healthcare is heavily decentralised, with municipalities having a big say in how resources are allocated. Seems democratic, sure, but it's also led to disparities, like rural areas facing way more challenges than urban ones.
Yeah, Sweden's a fascinating case. It's shown some success in tailoring services to local needs, but like you said, there's this trade-off. Smaller areas can sometimes get left behind because they don't have the same financial or administrative capacity as cities do. If that happens here, we're right back to uneven healthcare access.
And honestly, that's what Starmer's got to grapple with, right? Managing inequalities while making reforms actually feel democratic and, well, fair. Not an easy task. And how does this ripple out further? I mean, if we see this shift work or not work, it could really influence how we think about other public services too.
Absolutely. If there's a broader push toward more civic engagement and democratic control, it might inspire changes in areas like housing or education. But these systems are so interconnected that if one goes off the rails, the others could quickly follow.
Exactly. And that's not even touching on the cultural side of things, you know? Reforms like this might actually spark a wider societal shift, like people demanding more say in how they're governed. Which, in theory, sounds amazing, right? But it also risks amplifying divisions if people feel their voices aren't heard equally.
Right, and with politics being so polarised these days, it's hard not to wonder if this shift could, deepen those divides. That's why the execution here is critical. Starmer's reforms if they're going to succeed, have to balance inclusivity with actual, tangible results.
Absolutely. And at the end of the day, the NHS isn't just a policy issue, it's personal for millions of people. Whether this sparks a democratic renaissance or just becomes another political headache, the stakes couldn't be higher. Let's hope those making the decisions remember who they're really making them for.
Well said. And on that note, that's all for today. Thanks for listening, and we'll see you next time.